So we have Mr. G here. We're gonna do a head to toe. Whenever he comes in, I'm gonna be looking at the way that he walks, the way that he's talking, looking for any kind of listing or slurring, his skin color, anything that I can kind of tell at just a look. We're gonna get his height and his weight whenever he walks in. I'll be able to kind of see, especially if he is older as he is, if he's well taken care of, if there's any signs of neglect. If he is obese, which he's got a very rotund abdomen compared to his very skinny legs. Then I'll be able to just kind of see, is he screaming in pain? No, he's sitting here, he's perfectly fine. I'm gonna look at his skin. I'm gonna see if there's any kind of chance for pressure ulcers. He was walking, so I'm not really thinking of that as much. If there's any kind of like localized abnormalities, I'm gonna get his blood pressure, attach him to the monitor, make sure that everything is stable there. Then I'm gonna start looking at his head, his face, kind of start from the top down so I don't miss anything. Go take this off, see if we've got any kind of weird scalp situation going on. I'm looking at his face, everything is okay as for now. I'm gonna kind of palpate around, see if there's any tenderness. Ask him if he ever has any kind of headaches, dizziness, random bouts of vertigo. We're all good there. I'm going to ask him to look straight at me, do some peripherals like I would do for a stroke. I'm gonna do the pen light into the middle, come around, pen light into the middle, make sure that they're the same. And then I will, you can whisper to check like the kind of range of hearing, if you will. And you can just ask. I'll see if he's got any noticeable hearing aids in. Then I'm gonna look at his nose, see if it's deviated, see if it's, just kind of inflamed, broken looking. I'm gonna ask him to show me his teeth, see if he's got any dentures in, if he's got any kind of like rotting or like an abscess or anything like that. Stick out his tongue, look at the back of his throat. Is it red? Are we looking at any kind of strep? Has he been coughing or anything recently? Any kind of throat sores? I'm gonna palpate his lymph nodes going kind of up, down, and around under the bottom of the throat, making sure I'm never like pushing on both sides of the carotid at the same time. I'm gonna tip his head back and kind of tilt from side to side, see if there's any rigidity, and make sure that I'm also palpating in the top of the back of the neck as well. I'm gonna ask him if he's had any head injuries, any neck pain or anything whenever he gets home from work, or just on a constant basis or on a less frequent basis. I'm gonna go around to the back, and I'm gonna auscultate his back, top to bottom on both sides, and then in kind of like a side to side situation so I don't miss anything. I'm gonna hold my hand on the back, kind of like right on his scapula, and ask him to say 99 to check the vibration and everything there. And then I'm gonna come around to the front. I'm gonna do a Z-shape auscultation of his heart, listen to his chest. I'm gonna listen to his lungs. I'm gonna get him to take a couple deep breaths, see if that really does anything. Maybe it'll like start him coughing a lot, or he'll start wheezing a little bit. I'm gonna ask him if he snores at night, if he wakes up with headaches. He's got a real thick neck, so he's at a good possibility there for sleep apnea. I'll kind of inform him what that is. Maybe check in with Mrs. Gnome, see if he does have any times where he's snoring and then he stops for a couple seconds and does the really loud and then go from there. See if maybe he wears the little sleep BiPAP. I'm gonna see what's going on with his lack of arms. If they're just hidden in the beard here, then we'll do some range of motion exercises. I'm gonna pick him up, put him to the side. Does anything hurt? If it does hurt, when did it start? Maybe he's got a little bit of tennis elbow going. While I was listening to his chest, I'd be making sure if there's anything going on with like a male gynecomastia thing, but we're pretty flat here. Even though we've got a big neck, nothing's bulging. We don't have any kind of bruit going on. Then I'll have him lay down. I'm gonna listen to his abdomen, and then I'm gonna palpate his abdomen, see if there's any tenderness or if there's any like lack of sounds, constipation. I'm gonna make sure that I palpate down in the groin area as well, make sure we're not dealing with any kind of hernias. Gonna have him do the same stuff I would have with a stroke. Lift one leg, hold, then the other, kind of push against my hand, scratch this shin with this one, and then scratch this shin with this one, push against me, pull against me. I'm less making sure that he can do it since he's obviously old as dirt, and more that it's equal across the band. See if he's telling me about any kind of lack of sensation on either side, any random bouts of like pain that gets better with dangling, or any kind of evidence of impaired flow, either arterial or venous. See if we've got any kind of edema. I like to push right on the inside of the shin bone on either side. I'll ask him if he's able to go for walks. How long does he go before he needs to relax? Does he use like a walker or a cane at home? Does he use a motorized little wheelchair? I call them go-getters. If so, how long does he need those for? Does he still drive? Then if he's up for it, we'll do a round of the male genitalia. Gonna ask him if he ever does a self-testicular exam. Let him know that every so often when he gets out of the shower, he should be checking that everything kind of feels the same. There's no lumps or bumps or pain in there. Ask him how he's peeing, if he ever feels like he didn't finish peeing, or like he can't really start. Does it burn at all? If there's been any blood or hemorrhoids noticed in the stool, see if that all checks out. If he's of a certain age, guess we could look at like a prostate exam situation. I'm in the ER. Never had to do that. Hopefully I never have to do that. But I do have to do a lot of rectal temps. So it feels the same to me. But then we would kind of send him off. I'd let him know that he's got a real big waist circumference there. Let's put him at risk for a couple things. But overall, Mr. Gnome seems pretty useless with his lack of legs and lack of capacity to walk. So he's gonna have to come back for sure.